What's up guys, Zach here with Dr. Eyeball MD. Today we're going to be reviewing a video called 10 Great Exercises to Improve Your Eyesight. This video has 12 million views on YouTube and it's put out by the Bright Side channel, which has 28 million subscribers. I'm going to be giving you my thoughts as a budding eye surgeon, an ophthalmologist, as to whether I think these things have any merit to them. So let's get into it. So if you're new to the channel, I'm a second-year ophthalmology resident. If you don't know what an ophthalmologist is, it is a medical doctor, someone who went to medical school and is now specializing in diseases of the eyes, both treating them medically and surgically. So without further ado, let's get into reviewing this video. I've seen some little bits and pieces of it, but I haven't watched all the exercises, so this will be kind of my first reaction to a lot of these things.
Great exercises to improve your eyesight. Exercising your eyes is one of those simple things that very few people do. However, it can help you maintain excellent vision. Here are 10 exercises that will take you no more than 10 minutes to do. You can give them a try right now while watching this video. First off,
this is where I kind of question it. 10 exercises to actually improve your vision. I think there's probably some ways to keep the muscles around the eyes exercise, but I don't think it's going to help much with the vision. But let's see what they suggest.
We're going to do all of them with you. Exercise number 1, blink for a minute. This exercise helps to regulate blood circulation inside your eyes. Take your time and let's begin. Blinking is an excellent way to relax your eyes. It has 3 functions. It helps grease your eyes, clean them, and give them a break from light.
Okay, so this one probably does have some merit to it. When basically the tear layer that covers the front surface of the eye, it's actually a lot more complicated than you might think. It has a lipid layer, which is like oil that covers the front surface, and sandwiched in between that is an aqueous layer, a more watery layer, and then a mucin layer closer to the eye. And actually blinking kind of pushes the tears into the tear ducts, and it allows the meibomian glands, which are glands in the eyelids that secrete oil, to secrete that oil onto the surface of the eye. And that's what they're getting at here when they say grease your eyes and clean them. So that probably does have some merit, at least in terms of keeping the health of the ocular surface. So okay, I'll buy this one a little bit.
With a lack of frequent blinking, your eyes become dry. That leads to inflammation and poor vision.
So that is true. Patients that we see with things like Parkinson's disease that will just sit there the whole exam and not blink at all have really bad ocular surface disease. So there is some merit to this one.
Opening and closing your eyelids quickly without straining them. Do this exercise regularly to adopt the habit of frequent blinking. You can perform this exercise just about anywhere for 30 to 60 seconds. This practice is especially useful.
So a lot of people may notice when you try to read that your eyes may start to get blurry, and you blink more and it kind of gets better. That's just the eyes drying out, basically. All right, let's see what they have for number 2.
Exercise number 2. Rotate your head while staring ahead. This exercise increases the blood circulation in your eyes. You need to turn your head in a circular motion while staring ahead. First, slowly turn your head from right to left, then up to down.
So with this one, I think what they're really getting at is just kind of like working the muscles of the eye. So there's extraocular muscles, and if you look at the thumbnail in this video, those 4 kind of strands on the sides of the eye, those are the extraocular muscles and what control eye movements. And if you're going to keep your eyes fixed and move your head, you're going to be working those muscles. And yeah, I suppose it would increase blood flow, but it's not going to affect your eyesight. It's not going to help eyesight like the video is claiming.
Therefore, find 10 minutes every day to perform this exercise to have great eyesight at any age.
I don't think this one has a lot of merit.
Finish the
really.
exercise
I don't
in
think
a
this is going to do
calm
much for your
manner,
eyesight.
and then we will continue.
I like the animation though. Okay.
Exercise number 3. Look to your right and left. Again, you can perform the exercise for 30 to 60 seconds.
So I think this is getting at the same thing, basically. Moving the head, keeping the eyes fixed, you're going to be working the extraocular muscles. The lateral rectus muscle, the medial rectus are going to be working to maintain the position of the eyes. This is not going to affect your vision. I'm going to skip ahead on this one.
After finishing, close your eyes for a few seconds. Exercise number 4. Close your eyes and relax. Darkness is believed to help strengthen the photoreceptor cells in your eyes, which in turn can contribute to clear vision. All you need to do is just close your eyes and sit back.
There's a little bit of a stretch here, but basically, when the eyes are exposed to light, there's chemical reactions that go on in the photoreceptor cells of the retina, and you deplete pigments in the retina, and they have to actually replete themselves. So that may be what they're getting at here, but this is not really going to affect your vision in the long term in any way. Just shutting your eyes like this. Now, if obviously, if you stare at the sun for a minute and then try to look somewhere else, you're not going to be able to see anything. That's because you've depleted all the rhodopsin in the photoreceptors, and it's called no, it'll come to me. But anyways, you've depleted it, and it's going to kind of throw off your vision until the retina regenerates those.
Move your gaze in different directions. First, look right to left for 5 seconds.
And so I guess with this one, number 5, they had you earlier keeping your eyes fixed and moving your head, and now they have you actually looking with your eyes in different directions. And this is the same thing basically. You're working the extraocular muscles. Again, this is not going to improve vision at all. And strengthening the extraocular muscles, I don't think it serves a whole lot of purpose. Most people do pretty well, are able to move their eyes, with the, just from the strength they have from looking around. There are diseases, obviously, they're going to limit the movement of extraocular muscles. And in those cases, I think maybe some of these exercises could be helpful in strengthening that. But for most people, this is not gonna do much, and definitely not going to improve the vision, unless maybe you have double vision from some sort of misalignment issue.
Close your eyes tight for 3 to 5 seconds.
Okay, so this one,
now,
close and open
them.
your eyes.
Do it again.
I honestly don't know what they're getting at with this one. This is just closing and opening the eyes.
And
again,
one
you're going
more
to
time.
be lubricating the ocular surface here, but this is not going to affect vision.
Totally. You should do this 7 times. Exercise number 7. Push against your temples with your fingers. This exercise improves the flow of intraocular fluid. Slightly push against your temples with your fingers and maintain this pressure for around 2 seconds.
So
you should repeat the exercise 4 to 5 times.
The anatomy of this just really makes no sense. The intraocular fluid in your eye is actually produced by what's called the ciliary body, which produces the aqueous humor in the eye, and then that circulates into the anterior chamber, the front part of the eye, and is drained out through the trabecular meshwork, which drains through the episcleral veins of the eye, and into the the venous sinus, and ultimately back into the venous circulation to the heart. Pushing here, I really don't know what they're getting at in terms of increasing circulation. That does not make sense to me. It's definitely not going to affect vision or help vision either.
3.
And I don't know why you would want to increase your intraocular fluid.
Well done.
That's not going to help in any way.
Now, let's check out the next exercise. Exercise number 8. Draw geometric figures with your gaze. Keeping your eyes open, draw simple geometric figures with your gaze. You can start with a triangle.
So I guess this is similar to the other few that they
Then draw
showed
a
with
big
just
rectangle.
basically working the extraocular muscles. I don't see how it's any different.
Also, you can draw a square.
Again,
and
this is
circle.
not going to affect vision in any way. I recommend doing this in
You can
public
move
though.
on to more complicated
Just
shapes,
kidding.
such as a trapezium and parallel piped.
I'm not sure what benefit strengthening the extraocular
Exercise
muscles
number
is really
9.
going to
Move
provide
your eyeballs up
to
and
the
down.
normal person. And again, this is another one
First,
where they're
close
just
your
having you
eyes,
look up and down basically.
then slowly move your eyeballs up and down.
Same thing, it's just working different
Up
extraocular
and
muscles.
down.
You're working the superior rectus looking up,
Up
and the
down.
inferior rectus looking down, as well as the oblique muscles.
Keep doing it very slowly with your eyes closed. You can repeat the exercise 5 to 10 times.
Let's jump ahead.
Your eyes near and far focusing.
Okay, so this one actually may be
First,
interesting.
sit in a chair or stand in front of a blank wall. Place your thumb about 10 inches in front of your face and focus on it for 10 to 15 seconds.
So with this one, it looks like
Also focus on
they're gonna have you look at
object
something
5 to 10
close
feet away for 10 to
and then
15
something
seconds.
far away. So this one actually
Seconds.
is kind of interesting. So when you focus at near, something interesting happens in the eye. So the ciliary body, which is the same thing that produces the aqueous humor we talked about, the fluid in the eye is produced by it. It's a muscle, and it's a ring-shaped muscle. And supported on that are little zonules or lens, or little basically like strings that connect to the lens. So you have the muscle, and you have little strings that connect to the lens, and the lens is the focusing part of the eye, or the actively focusing part of the eye. And so what happens is when you try to look at something close, what happens is that muscle constricts and it lessens the tension on those zonules, and that allows the lens to take a more convex shape like this, and that allows it to focus light quicker. So when a light beam hits it, instead of focusing back here, it's going to focus quicker. And so that helps for looking at something up close. It allows you to do what we call accommodate, and focus at near. And then what they're going to have you do it, I think, is
Give it a try.
Then focus on something at distance. And so what that's going to do is basically work that ciliary body muscle from contracting and relaxing. And I think that's what they're getting at with this one. And actually, I think this could be somewhat helpful, especially for people who are nearing the age of developing presbyopia, which is the inability to accommodate and focus on things at near. If you notice your parents or your grandparents progressively start holding things further and further away as they get older, until they are going to need reading glasses at some point. Basically what that is they're losing the ability to accommodate, and their lens can't take that convex shape anymore. And some of that probably does have to do with the strength of the ciliary body muscle too. So this one actually may have some merit to it in keeping the strength of the ciliary body muscle. I don't know, but of the 10, I think this is probably one that may have some merit.
After
to it,
10 to
actually.
15 seconds, refocus on your thumb. Practice this exercise 5 times. You need to monitor your health as well. According to experts, good eyesight depends on your diet.
That is true.
Remember that the most useful food is natural food with minimal heat treatment, as it keeps the greatest amount of vitamins.
That's true. So things like you've always heard it, carrots. It's the carotenes, the carotenoids, the beta carotene in those are involved in the light reaction and actually the electron transfer that occurs when light strikes in the photoreceptor cells, and that's why the carotenoids are helpful. And they recommend carrots and bright, colorful vegetables to help with the eyesight. So overall, this video I think makes the claim of 10 exercises to help your eyesight. Of the 10, I think 2 maybe have some merit to them. The blinking to keep the ocular surface well lubricated, and then maybe the last one with the focusing at distance and near to kind of keep the tone in the ciliary body muscle. The other ones are mostly just looking around, which is will work the extraocular muscles, but are definitely not going to improve or increase your eyesight. Really, I don't think this video is meeting the claim that it's trying to make. A couple of those exercises may be okay, but really the most important thing is the diet, and to actually see an eye doctor, whether it be an optometrist or an ophthalmologist, to monitor the health of your eyes, because just doing these things are definitely not going to be enough, and most of them actually aren't going to help. That's just my take on it. This isn't meant for medical advice or anything, just educational purposes, and kind of to give you my thought on whether I think this video has any merit. A lot of videos like this are posted and they're not really done by medical professionals, so I just wanted to kind of share my thoughts with it as someone who does this on a daily basis. I hope you guys liked the video. I'm Zach with Dr. Eyeball MD. I think in the next video, if this video gets, let's say, let's go with 50 likes. If this video gets 50 likes, I'll make a video and we will react to the surgical scene from the Minority Report. I think that might be neat, where they take Tom Cruise's eyeballs out, and we'll kind of critique that. Anyways, I'm Zach with Dr. Eyeball MD. Thank you guys for watching. I hope you enjoyed it. I'll see you next time.